Welcome to another episode of Candid Conversations with Dr. Kelly. This is a special episode because it's just me, you guys. We are doing another Candid Questions episode where you all send in your questions and I open them blindly and answer them without any kind of preparation. So, if you follow me on social media, then you know that I am working on being vulnerable and letting you all see my authentic self because perfection isn't real. So here we go. I'm going to open the questions. Shout out to my amazing team who compiled these. And shout out to you all, the listeners and followers who sent in all of these fantastic questions. Just like last time, there are a lot of questions. So I'm going to do my very best to get through as many of these as I can. And we may need to do a part 2 of this Candid Questions episode as well, because you all are quite inquisitive and I love it. So let's dive on in. First question. And these are actually going to be specific to brain health, brain injuries, and sports. So, without further ado, first question. What are your thoughts on young children and teenagers riding roller coasters? Right out of the gate. Gonna hit me with one of these. All right. So, as a medical professional, very difficult to give details for an answer like that or for a question like that because everybody is different, from weight and concussion history, the kind of roller coaster, etc. But if we are talking generally speaking, my thoughts are children and teenagers, adults as well, are actually at risk for concussion when you ride roller coasters. Yes, they are fun. I have ridden roller coasters myself, which means, and as a child, which means that I could have been subjected to a concussion because one, you do not have to lose consciousness to have a concussion. And you also do not have to get hit. Your head, your brain does not have to physically get hit to sustain or experience a concussion. There are concussions that are inertial, or when you have enough force that the brain moves or shifts inside of the skull, and that can cause damage. So if you think about high G forces or sudden stops, drops, quick turns, those kinds of things can snap your head around. You can end up with whiplash. You only need 4 Gs of force to experience whiplash. And then, when you think about roller coasters, they don't have the best head support, okay, for your head, for your neck. And so all of those things are a risk because you experience all of those things. But if you are, if your musculature is developed in a certain way, if you are an overall healthy individual, again, that is subjective. I'm doing my best to be as general about this as possible. But you also have to consider other riders who may not be quote unquote healthy because they may have a history of concussion, or they may have just sustained a concussion and didn't know about it. They may have a history of multiple concussions. They may have a cervical condition, like cervical instability. They may have motion sensitivity. They may have migraines. All of these things play an important role in considering how someone is going to react or respond. But if we strip all of that away and we think about the science of it, if a human, pick the shape, size, development, all the things, if a human is put into a vehicle of some sort that goes Mach speed, obviously not really Mach speed, but goes extremely fast from, goes from zero to whenever extremely quickly, because there are those roller coasters that will take off so fast in the very beginning that it feels like your stomach is dropping. Not my favorite. I don't like roller coasters, if I didn't say that earlier. But all of that kind of movement and motion can absolutely affect someone differently. And there is an absolute risk for concussion when it comes to roller coasters. So please be mindful of that, especially following the rules for like height. If there are weight stipulations for anything, it very well or is likely for your protection and or your child's protection. So please take those things seriously. Ask questions if you have them, and better safe than sorry, listeners. Great question. All right, next up. Do concussions lead to potential dementia? You guys are really hitting them out of the park. Okay. Another great question. Long story short, yes, but not in the sense of, oh, I bumped my head. And I was diagnosed with a concussion. Okay, dementia is inevitably, going to take place in my future. No, that's not how it works. If if you have repeated concussions, that is the big piece here. If you're getting concussions over and over and over and over and over again for whatever the catalyst or cause of it is. It can be if you're an athlete. We are talking about sports in this episode, but we can't forget the other individuals who are at risk for repeated head injury. So that includes military members. Thank you to those of you who listen, and to those of you who serve. So thank you for your service. My entire family is military. So the things that I talk about, while I am a former athlete and all the things, I support and love military members. Like I said, my family, a large part of my family is military, and or a large part of my family are military. Either way. And so I definitely have military members at the forefront of the work that I am doing, as well as domestic abuse survivors, child abuse survivors, police officers. There are a number of people who could experience repeated concussion, but when you have it over and over again and that damage starts to take place, and it's harder to recover from it. And then you also have to consider, are these people with these repeated injuries also receiving speech therapy services? Are they also working with experts? Are they aware that they are sustaining these concussions and what's being done about it to rehab the brain back? So, I like to use the ankle analogy because you can't feel the brain unless there's a headache. You can't see the brain, but you can see and understand the ankle and the pain if you roll an ankle or twist an ankle. If you've played sports or been active or been on your feet for however many years, there's a chance that you, listeners, could have sprained or rolled an ankle, or any, body part that you can see or feel is what I like to use this analogy with when I'm speaking with my patients. And the ankle analogy is great because it's similar to what happens with the brain. So if you have a brain injury and you have an ankle injury, with the ankle injury, you're going to limp, you're going to feel pain, you're going to see swelling, you're going to be, motivated to elevate it, to ice it. It's not going to look right. It may be purple and, funky colors. And you're going to be thinking, oh my goodness, like what can I do to rehab this? And the brain does not get that same consideration. Next question. Can you talk about a diagnosis of post-concussion syndrome, signs and symptoms, and thoughts on treatment? Excellent question. So, PCS is when concussion symptoms last longer than expected. So, typically between anything beyond 2 to 4 weeks. And that will vary based on the age of the individual. But this is why it is so important to advocate for yourselves and talk to your physicians and your care team about what it is that you are experiencing. So, symptoms to keep an eye out for or to pay attention to are things like brain fog or slowed thinking, memory difficulties, if you're having a hard time finding your words, so you feel like something's on the tip of your tongue and you just can't get it out, or you're searching for the name of something that you're looking at or thinking of and it's just not coming. If you have a difficult time with concentrating, headaches, that is the number one reported symptom, the most popular, headaches or pressure in your head. Dizziness, nausea. Nausea is a big one. Definitely reach out to your PCP or the hospital for things dealing with nausea, especially in children. And light and noise sensitivity is another one. Neck pain, because if you have a concussion, then you likely also have whiplash. So, paying attention to moods and emotions. Are people more, are they easily agitated in a way that they weren't before? Are you noticing more mood swings or depression? Do you have complaints of feeling like you're not yourself or the person that you are thinking of? If it's not yourself, then the person that you're thinking of, are you feeling like they're not really themselves? All of those are signs to consider and investigate more if you are experiencing those symptoms. As for treating PCS, contacting a speech language pathologist is key for cognitive rehabilitation. And I talk about this all the time, how cognitive health is not the same as mental health. They are related, but it is not the same thing. So, you absolutely can go to a mental health professional. A lot of times when people get concussed or they have a traumatic brain injury that is more severe than what the medical community would consider a concussion, or a mild concussion. If you've been to my talks, you know that the field is trying to move away from verbiage like mild and moderate when it comes to categorizing concussion. Whole nother episode to talk about why and to get into all of that. But the treatment for that absolutely comes with working with a speech language pathologist. And it's important to find a speech language pathologist who has experience with this, because, as I've explained to people in the past, speech language pathologists, we have such a vast scope. And so, with that, you get professionals who specialize in certain areas. So, I'm saying, go to a speech language pathologist, but you want to make sure that the speech language pathologist has experience with concussion, with brain injury, with cognitive rehabilitation. Because if you think about medical doctors, you wouldn't go to a dermatologist if your arm was broken. So it's kind of like that. Both are doctors, both are physicians, both are, qualified and skilled, but one put all of their information and resources and studying and time into being a dermatologist. Another one did the same thing with ortho if it's a bone break. So it's the same thing with speech language pathologists. We have specialties that we go into. And so you want to find a speech language pathologist who specializes in this work and has experience with it. But treatment can look like, and again, trying to be as general as possible. I very much tailor my treatment plans to what my patient's specific needs are because one patient may love sports and that's what we're going to use. We're going to incorporate sports into their therapy because that's what motivates them. And if you are a therapist or you have worked in rehab or have been rehabilitated physically or cognitively to any extent, you know that motivation is a huge part of the process because you have to be motivated to do the hard things that are going to be asked of you. So, someone may like sports, someone else may love music. Either way, making therapy functional, making therapy fun as I can make it. This is real work, it's hard work. And so there can be less pleasant days where people are feeling down on themselves. There's a lot of I used to be able to, I used to. But I may, for a memory exercise, I may, if we're using music or sports, we'll say sports since we're talking about sports. If someone loves sports and they have a favorite team and we're working on their short term memory, then I would have them tell me about who they just played. What team did your did your guys, whoever you root for, did they go up against? So I will ask them where they played. I'll ask them about the score. I may ask them about a player. And again, this varies with the level of severity of the injury because one patient may be able to hold on to information for 15 seconds, and that's not an exaggeration. Another patient may be able to hold on to the information for 30 minutes before they have a hard time. If there's a divided attention piece, then I will incorporate, okay, you need to remember this information, but I'm also going to be, I could be having something to play in the background, and it could be sounds of a coffee shop, or if again a sports fan, it could be sounds from a stadium. How can you focus and either keep playing your sport, or if you are a spectator, how are you able to focus and still engage with the person that you may have gone to the sporting event with? And so there are all kinds of things that, one, we as humans can take for granted, such as having divided attention and being able to multitask, as well as being able to remember and being able to remember well. Hey, listeners. I'm inviting you to connect with me and be part of the Brain Talk movement. It's super simple. Just visit braintalkfoundation.org and subscribe to our newsletter to become one of my brain buddies. You'll get updates on upcoming Brain Talk days, find out when I'll be speaking in a city near you, and get insights on what's happening in the world of brain health and concussion awareness. Join our community of changemakers because together we can make a difference. Visit braintalkfoundation.org and become a brain buddy today. Speech has such a vast scope. I've said that before. We can treat a lot of different things. I'm trying to think memory, brain fog. There are also some strategies that we work on as well. So we call them comp strats, but compensatory strategies are strategies to help compensate for whatever the area of deficit is. So if someone is consistently missing their appointments or is consistently showing up to places and spaces late, then a strategy that we can use is incorporating the devices that we have available to us. So transitioning maybe from a paper planner to a digital planner and using what's in your phone. Syncing your calendars so that they show up on multiple devices, using AI alarms, there's, Amazon, Google, Apple, they all have something. So, using those as personal assistants to help them with reminders. I have a patient who, if we have a session at 2 o'clock, she will set her alarm for a 5 minute reminder. Early in our working together, we learned that that didn't work because 5 minutes was too long of a time before she could get distracted and forget that she was supposed to be waiting or that she had logged into the waiting room. And then she would go off and be in the kitchen and, or outside or just anything that she forgot that she was supposed to be in session in 5 minutes time. So we modified that strategy, and then she started setting her alarm for 5 minutes, and then 3 minutes, and 1 minute. So there are a multitude of different treatment approaches and things that can be done. And, there are even, you've got to be creative as a speech therapist because if you have someone who, reaches out and needs help, needs services, they may be an underwater basket weaver or they may be a prima ballerina. It's my job as the therapist to find out what is important to them, what motivates them, and figure out a way to incorporate that so that they actually want to do the hard work that lies ahead. Okay. I'm trying not to make these answers too lengthy. I'm so passionate about this topic. Like I could talk about this all day, but I'm trying not to. All right, next question. Birth control for headaches? Question mark. Tell us more. Oof. Well, I'm not a medical doctor, but what I can say is to my understanding, to my knowledge, birth control is specifically for hormone related headaches. So females can experience headaches around that time of the month, and a lot of times you can go to the doctor and report this, and the suggestion will be birth control because birth controls have hormones that can help to balance what causes headaches in females. So, um, that's all I'm going to say about that as a non-medical doctor and non-OBGYN. Thank you for that question. Moving right along. Next, I assume repetitive heading of the ball would have negative implications. Yes, question mark. In parentheses, soccer. You would absolutely be correct to the listener who sent this question in. So, that is a big topic for soccer fans, soccer players, heading the ball. So, it doesn't take much to injure the brain. So, you think about the brain, it's sitting in cerebral spinal fluid. And it's not like a swimming pool's worth, right? It's just enough to provide a buffer to your brain. And your brain sits in this spinal fluid in your skull, and it's supposed to absorb, if you accidentally knock your head when you're walking into the house. Sometimes, or on the car door or opening up a cabinet. Sometimes you can really, really hurt yourself when you do that, but that's like a large impact. So if you think about, the again, considering how everybody is different, every player is different, brains are different. Who has had a concussion before? Who has had multiple concussions before? And so when you take that into consideration with heading a ball, you are essentially repeatedly injuring your head, your brain. And that's not to say that every time that someone heads a ball, they're concussing themselves. That's not what I'm saying at all. But you significantly increase the risk of concussions the more that you are banging your head into anything. And, we don't have to be sticklers. I'm not talking about like cotton balls or anything like that. But repeated hitting of any kind to your head and or brain can absolutely increase risk for injury and definitely concussion. Next question. With middle and high school students who get into fights, how do we watch for TBI, especially with those who are not on IEPs? Ooh, really good question. Okay, so obviously with fights, you are putting yourself at risk as well as putting someone else at risk for a brain injury. The smartest, most efficient way that I would suggest or make recommendations on how you can watch for that when they're not on IEPs would be to speak with your school or speak with your school district to implement change to where if you have been in a fight, then you are placed on some sort of watch. And it doesn't have to be, you know, so extensive to where they're, restricted and all the things, but just something where you can keep an eye on that individual and educating, teachers, staff about what the signs and symptoms are. That's why I created Brain Talk Foundation because so many people need to know this information. It's not just athletes, it's not just coaches, it's not just parents. I mean, grandparents who watch their grandbabies or who watch their neighbors. Um, Referees need to know this, and cousins need to know this. Aunts and uncles need to know this. Anybody who, like, because we are all at risk for concussion, because the number one cause of them are falls. Anybody can fall. Anyone could get tipped over. Anyone could trip over something. Actually, a podcast guest that will be coming up is going to tell their story because of a treacherous fall. I hope that makes sense. Trying to like it, we're having to create and shape these protocols and things um, from scratch because there's not a lot of education and knowledge about it, not to the extent that other initiatives have. There's a long way to go. And so there is going to be a lot of, we've got to figure this out. And that's why I want us to work together. Brain Talk Foundation, there are other, wonderful organizations out there. We should all be working together to raise this awareness because the more you know, right? Okay, we're going to move on to the next question. What are your thoughts on return to play timelines for student athletes after concussion? Ooh, load me up with the heavy stuff. These kind of questions are tough to answer because I don't like upsetting people. And I know that's absolutely ridiculous for the work that I'm passionate about, especially in the sports realm, because believe it or not, there are some people who don't want to hear it. But here we go. Doing my best here. No preparation. What are my thoughts on the return to play timelines for student athletes after concussion? I think I think that overall, because again, student athletes, I'm thinking high school, but then there's also collegiate, there's also middle school, there's also AAU, independent things, tennis clubs of all ages. So honestly, I think it's the wild, wild west collectively. You only have like things that are regulated, like you have to answer to someone and it's serious, is at the collegiate and the professional level. I'm sure that there are other instances to where, there is more attention that is played, where there are strict protocols in place. But again, I also think that it depends on the sport. I have seen football players who have been concussed, and there is a consideration to let them back on the field, or they do get let back on the field. But there are other sports organizations like boxing, and they are not playing around. If you are concussed, then you cannot box. You cannot show up to a gym. You cannot get in the ring. You cannot spar. You cannot put on your gloves. Nothing until you are cleared. And again, getting cleared, that's a whole nother thing. Maybe someone else asked that question. I won't skim. I don't know what questions are coming next. But I think with the non-regulated, so high school, middle school, the independent youth organizations, I think that is the wild, wild west, because when you don't have stipulations, protocols, things in place, then it's kind of like what a lot of physicians will say, which is like, oh, like, let's just see what happens. Stay in the dark, stay off your devices, and, take it easy. We'll see how it goes. And that can be very dangerous because we don't know the severity of the concussion. We don't know the history of concussion, maybe in some places. And, there are sports organizations where I'm sure they don't have the question on intake or applications or whatever of, how many concussions have you had? When was your last one? Have you had rehab? We're not there yet. Yet. Listeners, I'm hopeful. Yet we can work together.
Thank you for tuning in to Candid Conversations with Dr. Kelly. I hope today's discussion left you inspired, informed, and ready to take on your next challenge with a clearer mind. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who needs to hear it. Until next time, keep striving for a healthier mind and a happier life. I'm Dr. Kelly, and this has been another Candid Conversation.